pregnancy is blood pressure. And that's one of the reasons that I have always taught moms and dads how to check blood pressures at home. So I've recommended blood pressure checking twice a day at home. You can buy a blood pressure cuff at any drugstore, Walgreens, Walmart, Target. They're easy to pick up. I recommend the middle of the road pricing, not the most expensive, not the cheapest, and keep a record. And of course, today, most blood pressure machines will keep the record for you, but there's no reason you couldn't keep it in your phone or write it in down on a piece of paper.
All right. Okay. So we went into, that specific thing, Doc, about a little bit. Give us some highlights more of Pregnancy Your Way and why people should pick it up.
Well, not only you should pick it up because you can get, like I said, choose your outcome. But another thing that's really important in pregnancy is eating. You have to have a weight gain, should be 2 or 3 pounds a month, probably about 30 pounds for a pregnancy. But sometimes eating is difficult during pregnancy. So the most important thing is to eat like you're diabetic. So you eat 3 big meals a day and 3 little meals a day. I've often said you should have 2 breakfasts. The one you can probably keep by your bedside if you're having trouble with nausea in the morning. Um, it's really almost anything works, but a lot of times people choose crackers or even potato chips, orange juice, apple juice. But that's a good combination. Drink that, sit down, lie down for 10 minutes, then get up and have a bigger breakfast. And your bigger breakfast should have protein in it. So, eggs. Eggs is a really good idea for pregnancy, one or two. You can have them any way you want to, hard boiled, um, fried, scrambled, doesn't matter. The thing that you should avoid is only cold cereal. You'd be better off eating a candy bar for breakfast than having cold cereal. The common breakfast is cold cereal, orange juice, and toast. And that's a carbohydrate load. And if you do that, you will be nauseated within the hour and feeling like vomiting for the rest of the day. So eating is really important during pregnancy. It's something that moms sometimes overlook and doctors don't talk about. So again, this is a technique I've learned from my patients. What works during pregnancy and weight gain is very important. You want to have a good, like a 7, 8 pound baby at birth. So the other thing is that's really a hot issue now is depression. And I have always invited the whole family, mom, dads, and the kids. And that's so that moms and dads and families can hit the ground running after pregnancy. Because the way it is now, it's like walking the plank. Moms, dads are shoveled out of the hospital because of insurance reasons, and they don't get to stay until they're ready. Years ago, we could keep people in the hospital for as long as we thought they needed to be until they were really ready to go home. Today, getting ready to go home isn't even part of the plan. It is how fast can we get you out? How many can we fill out our paperwork so it looks like we've gotten you ready? And then, of course, they throw 10 CDs at them to make sure they cover the material they should have covered firsthand. So, yeah, I think our book can add all kinds of benefits to um, pregnancy and certainly babies and postpartum.
Okay. I guess what has the feedback been from your book so far?
Well, I think that most of the people like it. They're kind of surprised, I think. We talk about topics that sometimes don't get talked about. For example, informed consent. what does it mean? How does it play out? So I think that's really important. And again, I think that we cover postpartum pretty well, postpartum depression. And I've had no moms suicide. As a matter of fact, in my 40 plus years of experience, no maternal mortality in the patients I've delivered.
All right. Okay. That's best place people can go is Amazon to pick up Pregnancy Your Way, right, Doc?
I think that's a really good place. Yes.
All right.